This is a partial 3D reconstruction of a human embryo at Carnegie stage 10 at the beginning of the 4th week of gestation. The myocardium is shown in green, the foregut or pharynx in brown, and vascular channels in red. By this point, the heart tube has formed and in this embryo has begun to loop to the right. Compared to the stage 9 embryo, we no longer see the trough of myocardium, but a complete tube has formed now. It is still partially attached to the prepharyngeal mesoderm by the dorsal mesocardium, or the stalk that connects the heart tube with the prepharyngeal mesoderm. We can see that this has begun to break down in spots. If we look between the pharynx and the developing heart tube, you can see blank areas where the dorsal mesocardium has begun to break down because of looping. This process will continue so that soon the heart tube will only be connected to prepharyngeal mesoderm at the inflow end or the atrial end here and at the arterial or outflow end here. We can also see from looking at the pharynx or foregut that midline closure of the embryo has progressed more caudally. This is now the anterior intestinal portal, and it's moved back quite a bit. The two large vascular channels here are the dorsal aorta on either side, and the primitive aortic arch arteries are seen here. The inflow into the heart tube is here on both sides and represents the umbilical vein as it's coming back into the heart tube. If we now make the myocardium transparent, we can see the vascular channel or the endocardial surface on the inside, and we can see that the two venous inflows come together into a single heart tube, and this continues as a single channel through the tubular myocardium and then out at the arterial end into the two dorsal aortae. We also see that there is an external layer here of myocardium on the outside of the heart tube, and then a thick layer of cardiac jelly between the endothelium on the inside and the myocardium here on the outside. So this is a stage 10 embryo where we see a single vascular channel now running through a formed heart tube that is still partially connected throughout its length to prepharyngeal mesoderm. By this point, the heart tube has begun to contract, and in this embryo, as we noted earlier, has begun to loop to the right.